Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. I am with my BFF, Lori, today, who's in town from Ohio. That is where I grew up. And so she's still in my hometown, which I love. And I wish I could get her down here, but every once in a while I get her down here, like every quarter or so for at least a solid week. And sometimes I'll, create some weather to prolong those trips.
Like yesterday.
Cancel the flights, prolong the trips, all the things. But so Lori, if you want to introduce yourself, and then we're going to talk about a lot of different things.
Yes. Lori Naples, and I am from Ohio, east side of the state near Youngstown. Everybody always asks what part. That's kind of where I'm at. Debbie and I have been friends, or Dr. Dr. Durst, have been friends since 7th grade, and we just know everything about one another. So I come up, travel. I'm a remote patient for the last 4 years or so. And so I come up for all the things. So that's what we're going to talk about today. All the things and various other treatments that are nice combinations, products, the office, all the things, about all the things.
So actually, even a funny story with this, just giving you a little history and doing personal, is that, again, we've been friends for a long time, and our birthdays are 1 day apart.
1 day apart.
Yeah.
Both
so we're
Libras.
both Libras.
Yes, both Libras.
So way back when I opened this business, and not this location, but the business in general, again, my story is I worked ER, I'm an ER physician. Worked ER for many years, started to get tired, just run down, working night shifts, raising 3 kids, the usual stuff that everyone goes through. And then you go to your doctor, or you even hear other staff members or patients, they feel the same way, and everything looks normal with their tests. So that's when I started. I went to my first anti-aging conference. And I don't think you went to that one, although she's been to many with me.
Yes.
So she knows it almost as well as I do at this point. So I went to my first, and then I realized there's all kinds of different, things that you can do to prevent aging, both aesthetically and just in general, wellness. And so, I opened up my businesses mainly hormonal at the time, because again, that's what I was going through. And the aesthetic piece kind of naturally just goes along with it. People come in and then they'll want this or they'll want that. So it was just a natural extension. So I remember telling Lori, I'm like, I'm not going to do very well with this, because
yes.
I can't
I didn't know where you were going with that, but now I know.
I'm not used to picking out flaws in people. So people will come in complaining of, how they feel. And that I completely could identify with, but I wasn't used to looking at somebody and picking out flaws. So they would say, oh, I want to get rid of this line or that line. We'd start talking about things. And I was like, oh, you look great. You don't need anything done. And I remember having a conversation with Lori saying, I don't think I'm going to do very well in the aesthetic piece of it, because I'm just not used to picking out flaws. Yeah. And so I just keep telling them they don't need anything and they want stuff. And so then, fast forward, a few years later, I'm in Ohio visiting, brought some stuff up, was doing some stuff. And I was like, well, I think you need this. I think you need that. And she's like, whatever happened to that doctor and friend I knew that had trouble picking up flaws? Now all of a sudden you're telling me all the things I need. Yeah. So, fast forward, you do get
which
used
is a good
to,
thing. Which is a good thing. Yeah.
And it's not like I'm picking out, but again, if somebody
you're helping.
will. Yeah.
You're helping. Yeah.
But
well, it's what you do. And everything that you offer, and it's just what you're offering to people.
Yeah.
So
and how you can improve things. But it is a funny story, because it was just cute for her to look at me and she's like, "Whatever happened to that
girl's
person?"
gone.
That girl's gone. Now you're picking up flaws. What do I need? What do I need? Yeah. So anyhow, so Lori comes into town every few months, and she spends about a week here, and so we do all the things. Yeah. And so she'll see, I send her before and after pictures. I tell her about new treatments we're implementing, and
unbelievable.
Lasers we're adding. So I tell her all the things. She's like, I got to get down there. I need all the things when I'm down there.
I need all the things.
Yeah,
that's what I said before I got here. I need all the things. I'm coming for all the things.
So we're going to talk just about this trip and a lot of different things that she had done, and if it leads to some other services on other trips, we'll talk about it. But again, we do see a lot of remote patients. Lori just happens to be my BFF and a remote patient. But we see a lot of remote patients that want to travel into town and get lots of things done over a couple day period. And so We'll talk about what you can combine,
Mm-hmm.
you know, in one treatment or one period of time, you know, down, and how you can do the same procedure or different procedures at the same time.
The benefits of it, or
Yeah.
how it makes things easier.
Yeah.
Kind of, yeah.
And I like to give the medical aspect of it, and then Lori gives the patient perspective. So it's a great way to hear about procedures from both angles. So,
Well, a lot of times when I'm visiting, I'm just sitting in the IV room and get talking because I chat with everybody. And
she makes friends with everyone. She can make friends in an elevator. I've been saying that for years.
says, yeah. But
I'm not that person.
Yes, you are. But anyway, different patients will talk, and they're always asking, well, does that hurt? And, you know, how does that feel? And how invasive is that? And so with that, I just thought it might be a good idea to talk about it from that perspective. Because that's, I think, one of the biggest things with patients is, what's that feel like, and how invasive is it? You know, is there pain? Is it going to kill? You know, all those kinds of things. You know, so that's what we're here to. Yeah.
So again, maybe we'll talk with, you know, just starting. So one of our lasers, the Fotona, is a beast,
which I love.
Laser.
I love the Fotona.
It's one of our favorites, and it's a beast of a machine. So it's not in every office because you really have to be skilled to use it. It can be dangerous if you don't know.
Very skilled in this office on Fotona. I will flat out say that.
Yeah. And Marissa and Meredith do those procedures. I had to kind of learn the science of that machine behind the scenes. I'm just not doing it on a daily basis. Those girls are amazing with it.
Amazing.
And so you got 2 procedures with that machine. And again, Marissa and Meredith are phenomenal.
Actually, more than that. I had pain management too.
Okay.
Yeah.
Yeah. So we'll talk about, I mean, that machine does about 170 different treatments. And again, you can just change a couple wavelengths, duration, spot size, all that kind of stuff. And again, to know all that, be skilled enough with the safety.
The safety is a huge thing.
Oh, it's
and
huge.
I mean, yes, you're my BFF, but in knowing how particular you are and brilliant and all that, I know that I'm going to get the best care. But then I come in and I've seen all the girls who I love, everybody in this office, but I've had both Marissa and Meredith, more Marissa on Fotona, but I've had both girls very knowledgeable, and I feel 100% like this is like, if you ever wanted to try Fotona, come to RMD, RevitalyzeMD. The girls here know that machine inside out.
Oh yeah, no,
feel very safe.
They're incredible. And so Marissa's now actually working with Fotona and doing trainings on other offices, which I think was a natural progression. And I fully support her in doing that because she's amazing with the machine. So if we go to training, and we're going to something next month, that, you know, I'll speak about some services, and then Marissa and Meredith are there, but offices that want those hands-on experience, you know, Marissa and Meredith are phenomenal at doing that. And so you can see how comforting they are during it. And it's a scary machine and scary treatments.
Very powerful machine.
Yeah, until they kind of walk you through it. So 4D is one of the services we do. So it is a non-surgical facelift. And so we're using the laser to stimulate collagen elastin in every layer of the skin. So deep dermal to epidermis. So the entire mattress is being thickened. And so you're stimulating collagen elastin. So again, if we get those fine lines and wrinkles and we get a little sagging, it's because we lose collagen elastin about 1% a year. So you have to stimulate it. It's one of the machines and treatments that actually stimulates both. And so you get plumping of the skin, but tightening and lifting. And so you had that.
I had that 4 days ago. And do you want to talk about the different steps of it, and like what, like the first one's like in the mouth?
So I can talk medically if we even did so there's 4 different laser treatments in one sitting. So you're there for about an hour getting a 4D, and there's 4 different laser treatments. So there's in the mouth. So first we're going inside the mouth. So we're doing the intraoral,
which is nothing.
And nasolabial fold. So you can get that deep dermal by going inside the mouth with the laser and heating.
And it sounds scary, but it's not. Like that is like the least invasive of the whole procedure is what is my thought on that. You just keep wetting your lips, wetting your mouth and all that, and you're fine. Yeah, you're good.
It's good. Yeah. And so again, but everyone's like, you go inside the mouth.
Yeah, right.
You know, it's a big thing, but you can't get to the deep dermis unless you go inside,
From the
because
backside.
all therapy was one that used to go from the outside. And so you would have to go through all the layers of skin, very painful, and you get no benefit initially. So it's
This
not a
was
very,
this was
nothing.
pain. No, you're very verbal. And again, I had Marissa the other day, so I'm going to probably refer to her a lot, but she's very specific in her direction. I'm doing this. I'm going to be here. Let me know, give me a sign. And that's what you do. And when you're done, when you're ready, you verbally say whatever you're going to say. And then she stops and starts again, lick your lips, wet your mouth, wet your whistle, and go. But seriously, nothing. Not bad. Nothing.
No, it's not painful.
No.
And that's the deepest dermis. And so again, all therapy was extremely painful to get to that level, but now it's not. So the second step, then we come to the outside and we're doing kind of a deep, a dermis, or not deep dermis, but like a mid dermis, and you're heating. So you're bulk heating on the third step, but this one, you're going to quickly get that skin up to temperature in the mid dermis. And so that was
same thing. It's a little bit more, but it's just a verbal thing. You just, and then they can kind of gauge as to how many pulses you're going to, she's just so good on this machine. She knows by 2 or 3 times how many pulses to stop at, how many to keep doing. She knows when you're going to say, yep, no, okay. And then she just keeps moving. And so again, and that's pretty much through the whole rest of the procedure, truly. As long as, you're verbal about it, she stops, you're good. You're good.
And this one is pretty quick, and there's a cooling that you can use with it. But this one's pretty quick, and it's going to get pore size. It's going for a little more for pigment with that.
Yes, I've peeled a lot the last 2 days.
Yeah, you're still very dry.
And they have products that they will recommend. I would highly recommend purchasing those, because then you can use them at home and they really help soothe the skin. There's a couple different ones that you can get, actually 3 different ones that you can purchase. I highly recommend that you do that, because it's only going to help calm the skin, heal the skin properly through that phase of all the sloughing and the how dry it is and that. But
and again, you're like 4 days out now.
4 days. It was 4 days ago. Yeah.
So it's 4 days. Like there's no downtime. There's been no downtime at all with this. But again, if you use those products, you have less downtime. You're still going to peel a little bit, but your best results are about 2 months out. So it continues to get better and build collagen elastin. So,
and I would say the fourth step is probably the most invasive, but again, to get really good results, it's going to take more to get that. So I've had multiple different lasers here already. I've never had the 4D before. So this was my first time with it. And I would say the fourth step was probably one of the most, one of the more invasive when it comes to the laser part of things. What did I have the last time? One of the
LazeMD.
The LazeMD, yeah. And I was pretty red after that and everything. This one I wasn't as red with, but I am peeling a lot. But I'm already seeing all the dark spots getting less and less and lighter, and as it peels off. So it was worth it,
And so the third step is actually a bulk heating that you go over, the entire surface, and you're getting bulk heating. And then the fourth step, which is actually technically, medically speaking, the least invasive because it's the most superficial. But what she means is like, it's probably the most intense.
It's more, it's more intense, but they give you these little squishy balls to hold. But again, you're verbal with it, you're good to go.
You okay?
Oh, yes. So, you get the taps.
Yeah.
You get the.
So Marissa always taps. So like even one time, I think Marissa and I were traveling to a meeting and she tapped me for something. I'm like, I feel like there's some pain coming with that somewhere. And it wasn't.
Okay. So let's interject the AccuFit. If we did AccuFit, because I didn't have any other procedure done while I was having that. So, but I coupled the AccuFit and Transform with another procedure that I had done. So, and I think that is the way to go. So if you were to put the AccuFit on your thighs as they're doing the face, it's something that's a total mind distraction. So, and I think it would work. I would like to try that the next time, like get another 4D, because it's worth going through that, to get that nice. Like I come and I look at her and I'm like, your skin is amazing. It's just glowing and it's beautiful and it's amazing and it's tight and it's all just completely what do I want to say? One color. It's beautiful. And
thank you.
Well, it is.
And again,
it's true.
it's really because, and I don't get on the table all that often, but probably once a month I'm doing something. So meaning that I could do it much more. And I think some do, but I think when you're doing regenerative stuff and you're resurfacing and you're smoothing, you're basically smoothing things.
And I haven't had a lot of resurfacing so much. I've had the RevitalyzeMD, but I've had a lot of IPLs, which help, but it's the resurfacing that I truly need. And truly what everybody needs, because it does change the entire skin surface of the skin, texture, tone,
lines, wrinkles, pore size, everything, pigment.
Yes.
All of it.
And that's just it. She's like smooth. I mean, her skin just looks amazing, as well as all the girls here. So, she's like, okay, then you're getting a 4D. I said, okay. So it's worth it.
No,
It's really,
and I cannot wait to see the best pictures are going to be 2 months out, so then she's going to send them if she's not here, although we may see each other, we're going to, maybe a football game, college football game or something. Maybe. Yeah. Something like that. And, see family, something. So, but 2 months out will be the best picture or the best pictures after, because it does get better.
I'm so excited to get that skin. So excited to have that.
So I will tell you that what she kind of paired close to that, like back to back, was, so the 4D is our non-surgical facelift. And, we've been doing that for many years. And last year we implemented the 4V. It's our name for the facelift for the vagina. And again, we are super excited and stoked about this procedure because we went to a conference about a year ago. They said you can do the 4D on the vaginal, on the vagina. And so we started doing it. We did not expect to see the results that we have gotten. So we've done an event to tell women about it. It's on our website. We call it the 4V, but it's the 4D facelift on the vagina. So it's our name for the 4V, the vaginal facelift. So she had that procedure done. Long story, since I was long-winded with that. But she had that done. So how painful was that?
Okay, so let me backtrack. Now that I'm thinking about it, because I've had so many things done, I did have AccuFit and Transform both while I was having the 4D. Because you can't with the 4V because of the spatial. Yeah, the spatial issue doesn't work with all those. I got
Transform.
Yeah, all those big pads
things,
and everything. I doubt that. I'm sorry. I've had so many things done that I don't even know what ends up. But so it does. It's a very good thing to have both of those done. So, but the 4V is nothing like the 4D. Like everybody, like I talked to patients out in the IV room, nothing like the 4D on the face. Way less invasive. You have the Zimmer machine, which is a cooling machine. She's doing that as she's doing part of the procedure. And then while she's doing step maybe 2, 3, 4, then you're holding the Zimmer and you're kind of putting it where you need it to be. So total distraction again, cooling things off, but like nothing even close to the 4D
not
face.
Painful at all.
No, it is not. So any female that is looking to do that, do it, because it's nothing like what you think it's going to be. Nothing down there.
And so like, again, the 4D is not too bad, but again, from a standpoint of like, it's just different, because you're going to go through many different things. It feels different. It's different layers. The 4V is like completely comfortable. The results are ridiculous. We will do before and after. It's not going to be Lori's, but we'll do before and after. We have a ton of before and afters for the 4V. So we'll refer you back to the website. So we would never affiliate one on the video of Lori. But we have, but I would love for you to at least see what you can get.
It's amazing. The results are amazing.
Yeah,
I mean, and lightening, brightening, tightening,
all of it. So all the things for that. And again, that's an external, but we do internal treatments for tightening and, lubrication and all that. We did not do that.
That work.
Yeah. That work, yeah.
Yeah.
Lubrication, tightening, orgasmic strength, all of the things. But this was an external one because she got pictures all the time. Before and afters, I would send them.
Yeah, and I'm like, wow, that's crazy, amazing.
Yeah, no,
it's not. It's nothing surgical.
No,
but yet it's a completely different.
Not
look.
Even something you think of, but if you, and a lot of women, when they see the before and afters, then they don't even think about it until then. So every woman that's ever, like every woman needs this.
Yeah,
Like we have a ton that have never had
Mm-hmm.
children that are very young, and it's still amazing results.
Right.
So because let's see so the Transform and the AccuFit were good
Mm-hmm.
treatments to do with, not painful.
No, so there's such great, because you can choose your level. So another thing is I'm like one of probably the more super sensitive people that come into the office. Things,
She's just very aware of her body. She's a Pilates instructor, owns a studio, so she's just very aware.
Mm-hmm. And so it's intense. So it's good for me to get those distractions. And so again, you have people tapping you have stress balls, but what I really, really liked was when I had, again, the AccuFit I had on my thighs, I had Transform on my abdomen, and wouldn't matter which you're doing where, but it's just that electric stim with it that helps to give you that mental distraction. And it's like taking away one of your senses. You add senses and then you don't hear as well, you don't see as well. But if you close your eyes, you can hear everything so clear. It's kind of like that correlation. Mm-hmm. So with that, again, being super sensitive, for V, no problem. O shot, no problem. The 4D, a little bit more, but again, AccuFit, Transform, perfect to pair with it. Mm-hmm. And get your products for aftercare. And
so they're really like, just so EMS, is AccuFit. So it does, like, even if you did an ab workout, it's like doing 67,000 sit-ups in a 30-minute period. It's an electrical stimulation. So the thought is sometimes we use a vibratory device if we're doing some filler treatments. If you have a second nerve pathway that is stimulated, you don't feel the other one. Yeah. So you're not going to feel both at the same time. So it is a great pain distraction, or just a distraction from discomfort. Yes. And also it actually helps to, like, I have, long time ago, our cheering days and dancing and all those kinds of things. I have low lumbar disc issues, sciatic issues, low back pain, SI joint dysfunction, whatever you want to call it. And so my back gets tight and things. And that actually helps. The AccuFit, any kind of electric stim, whether it would be the AccuFit itself or the Transform, because it has that, then it's like pain management for me. So it just helps to relieve a lot of tight muscles. So that's kind of like another benefit to not just getting the workout and all that. It's like the pain management part of it is huge. Oh yeah. Huge. It definitely takes away from the joint and makes the muscles better. So, or, stronger, and takes off, the joint and the back pain. Yeah. My body loves electric stim. So it's, awesome. It just makes it feel so good. Yeah. So we should do it on the breast lift next time, is what you're saying? Yes. So we did the vampire breast lift. So everything she's about to talk about is probably like, everything else was nothing. Yeah. Again, that one's an intense one. So I'm thinking that's the one I was thinking I should have had the thighs going at that time with AccuFit, because I've had it 3 times. And the second one, I don't know why, I didn't feel nothing like this third time. But yeah, that was a little intense. So AccuFit on the thighs, I think, would probably be a very good idea. And I think it depends on like just what's going on with the skin. But we do numbing medicine topically. Again, I've had all the procedures. There's nothing that pretty much with women that we have in the practice that I haven't done. We call myself a slut for science, because, I try everything. Like, again, why am I going to bring it into the practice if I haven't tried it? Is it beneficial? Yourself. Correct. I want to know what patients are going through. And a lot of the girls too. Yeah. All the girls in here have tried various things, which is great that she offers that to them. So they know what it feels like, and, they can talk to patients about it. And again, if I don't have a penis, so I can't do the penile treatments, but like, again, I can tell you that patients are comfortable. Other than that, I'm a slut for science, and we'll do it all. And so I've had all of it. The vampire breast lift way back was the most uncomfortable for me. Mm-hmm. Didn't want to do a first one on her. Didn't think I would ever do them. The results are amazing. And it actually was immediate. It was easy and actually pretty prolonged, like up to a year, you'll still get some effects. So it's more cleavage. It's going to build out that cleavage. And so it's great, for cleavage in a bra. Mm-hmm. It's not going to lift. It's not a surgical. Right. So you're not going to get surgical correction. But if you're looking for PRF. A little lift. Yeah. Right. PRF. Yeah. Well, PRF and PRP. So we now combine both. We used to do PRFs or PRP only. So again, that one was a little. I think the difference between the two. Yeah. So the PRP is great. I love PRP, face, all that. Very good. PRF, a little bit more invasive and a little bit more intense for sure. But
but again, it just looks better. It's just better results.
Yeah. PRP is like the starter, PRF, and then we'll have to like kind of finish up quickly though, because I want to say just one more thing about like PRP, PRF, and then PRF gel is something we're doing under the eyes,
which I had
for
too.
a fill, and so we had that too.
Amazing results.
Yeah. So that one is something that actually fills underneath the eye. So we're actually again getting the PRF, which is a little different, and you can look at one of our videos that compare the two. And then PRF gel kind of takes an albumin component, so it makes it almost like a filler. So that's a great under eye. So again, we're always offering something if there's a progression in what we're doing that offers better results. And so, but that was comfortable, pretty comfortable for you. But it's injectable. So
the PRF,
gel, nah. Yeah. She doesn't like needles.
Yeah. My body doesn't do very good with needles, but it's more intense. And I think the AccuFit would have been a good one to go with that. Again, it was intense. Yeah. The PRP, I'm fine.
She does not like needles at all.
Yeah. And
I don't blame her. Like, and again, she's very like aware of where a lot of people kind of get used to
what's filling that tissue. So think about that, but again, but the results are better. Yeah. I mean, they're immediate, and it's only going to get better, which is phenomenal. And so, no, it's awesome. I get it. But that's why I wanted to talk about it, because I think the AccuFit and Transform are great platforms to add to these more invasive procedures that get you faster, better results.
And always more naturally.
Yes.
Younger. So those are all, we like regenerative and things that give your body back what it needs. We do like to set up expectations for pain. We like to discuss. We have different options that we can help. We have, laughing gas if you need it. We have topical. We can inject, for pain control. We have some medication we can for certain procedures administer in the office. So we like to set up the expectation because it's always a question, which is why we're discussing it right now. And so again, if you guys have had procedures, want to share some experiences, please let us know, like, subscribe, share with friends. Sharing is caring. The more that you can share videos so they can hear about it, they want to hear from patients and not just us. And again, just remember, thank you, Lori, so much for coming and having it all done.
It was great talking today about it.
I know. We just put her to, she doesn't even know if she's coming or going when she gets here. Where am I going? What time?
What end is up? Everything's numb.
Yeah, that's good. Doesn't know what's next, but that's what happens. But that's what's good. And a lot of patients come down to do exactly that. So again, like, subscribe, let us know what you want to hear more about. And again, we're here to revitalize your look, your health, and your sex life. Thank you.